It was one of the first operations that I performed, and a veteran came in with abdominal pain. I was on call in the emergency ward. We examined his belly when I took out his gallbladder, and there was no evidence of cancer left in his body. This patient had undergone one of the rarest events in all of medicine, and that is the spontaneous regression of a widespread cancer in the absence of any therapy. Somehow, this patient's body had learned to destroy his own cancer. And I've spent the last 40 years or so trying to figure out how that happened. Could we reproduce it in other patients? And now, in the last several years, there's been an explosion of information that enables us to help larger numbers of patients by getting their body's own immune system to fight this disease. There have been some startling advances, even in the last few years, that have been the result of the genomic revolution, our ability to detect and sequence the human genome. And what we can now do when a patient comes in, and what we did with Judy Perkins, is take a piece of her tumor and do what's called whole exome sequencing. We could sequence her entire genome of all of the genes that were expressed in her body and identify the genes that coded for any mutations that in fact caused her cancer. So if I had any advice for you, following a cancer diagnosis, it would be first to seek out multiple opinions as to the best care. Because finding a doctor who is up to the latest of information is important, and it's always important to get other opinions so that you can make the best decisions for yourself in consultation with your care providers. And here at the NCI, there is a patient referral service that will guide patients to the right group depending on their disease state, so that they can gain access to these new experimental treatments, and many of them are being developed at major universities around the country as well. Well, we've made some progress, and I'm proud of some of the progress we've made. But when I lay awake at night, I don't think about the patients that we've benefited, some of which we've cured. I think about all the patients that have not responded and still will not respond to the treatments that we've developed. And that's what keeps me working almost around the clock.